So in this discussion, we're going to look at tissue injury and healing. So as a strength conditioning specialist, in many job settings, you're going to be working hand in hand with the athletic training and sports medicine staff when individuals are injured. Also, it's not uncommon for many strength conditioning specialists to be dual credentialed. So a lot of this information does cross over. Obviously, the strength and conditioning specialist has a different role than the athletic trainer has with managing the injuries, but nonetheless very important to kind of know what goes on. We'll also be discussing just some basic injury terminology in this talk. So some different types of injuries. So we're really just going to be looking here at some terminology regarding injuries. So you have a macro trauma. So this is classically what we think of with like an acute injury. Okay, so a macro trauma is a sudden specific episode of overload or injury to a given tissue. So this is again that one-time kind of acute traumatic injury that happens. In a sporting event, contest, or taking place during some form of activity. A dislocation is a complete displacement of joint surfaces. You've probably heard many times of individuals dislocating their shoulder, for instance, very common injury to have happened. So a dislocation is when you have a complete displacement. So in other words, the joint is completely out of alignment, if you will, and there'll be significant soft tissue trauma there. That's as opposed to a subluxation, which is a partial displacement of the joint surfaces, or you may have a situation where the joint kind of comes out of place but then sort of self-reduces. That's also considered a subluxation. A sprain is trauma to a ligament, which will very commonly happen. You'll also get ligament damage when you have dislocation and subluxations, obviously, because the ligaments are what essentially hold the joints together. They're going to be classified typically as first, second, or third degree, depending on the severity. So depending on whether the ligament is maybe just stretched, partially torn, or completely torn. So typically with the basic ligament classifications, and sometimes in some literature you'll see this expanded upon. You'll also maybe even hear like terms like 1+, 2+, depending on if there's like multiple ligaments damaged within the area. But basically, if we're just looking at first, second, and third degree, essentially you're looking at a first degree is basically like a stretch of the ligament. Second degree is a tear or partial tear. Third degree is essentially a complete tear of the ligament. So just something for interest sake to bring up here. So again, here you obviously have a very traumatic injury. I don't know if you can guess what's going on here, but you have to look. If you look very closely, I'll bring this up in class and I'll see if anybody could figure this out. But looking at this picture, obviously there's a lot going on here, but what would be the big thing you would be looking at? So I'll bring this up again in class, but I'm curious to see if anybody will look at it because it's kind of hard to tell. Everybody obviously like looks at the barbell and what's going on, but take a second to look at this picture and see if you could tell what's going on. Okay, so some other types of injuries that we look at here. A contusion is just basically a medical term for a bruise. So usually this is just a musculotendinous injury caused by direct trauma. You could also have, what they call deep bone bruises, which many times people will think are fractures, and there may be some small amount of fracturing taking place, but bone bruises do tend to be very painful. A strain is when you have a tear or extreme stretch to the muscles. Okay, so a sprain is to ligaments, a strain is to muscles. Okay, same thing as the ligaments, classified first, second, and third degree based on severity. Again, with the same kind of idea behind how you would classify that. And then you have so then we have what's called a micro trauma. So a macro trauma, again, is just what we described, and we described a lot of terms related to macro traumas. So a sprain, a strain, a contusion, they're caused by that one-time injury. A micro trauma is an overuse injury. So this is when you kind of get repeated stress to a tissue, or a tissue kind of gets overloaded in a short amount of time, not enough recovery. And basically what happens is you start to have a breakdown in that tissue. So this is a little bit of a different injury process. And the healing process, so the healing process that we're going to talk about later more directly relates to macro traumas and a lot of the injuries associated with that. A micro trauma, or more of these more persistent pain type injuries, they kind of have a little bit of a different process to them as far as like, and which sometimes makes them also very difficult to manage. And sometimes it requires a little bit of critical thinking as far as what you have the individual doing with them. So some examples of micro traumas. So a stress fracture. So unlike a regular fracture to a bone, where again typically you have a one-time injury where the bone breaks, a stress fracture is a very common overuse injury, and this occurs in bones. So basically, again, with repeated kind of trauma, the bone doesn't have enough time to adapt. So again, our bones are constantly remodeling. They're breaking down and building up based upon stresses that are placed upon them. And when you have controlled stress to bone, that's a good thing. It actually makes the bones a lot stronger. However, when the bones can't recover, that remodeling process gets thrown off, and you eventually start to get a breakdown and cracks basically in the bone. And in stress fractures, there's different degrees of them. Early on, you won't see stress fractures show up on x-ray, so there's other diagnostic testing that needs to get done for stress fractures. If they've kind of been around for a long period of time, they'll eventually they will show up, but typically they don't tend to. Tendinitis is overuse injury that results in inflammation of a tendon. Now, I'll kind of do a little aside here with this. Most forms of tendinitis actually don't have an inflammatory process going on. Again, they're just a degenerative process. So it's a little confusing. It's, when we hear the term itis, inflammation is always associated with that, and you see this here in kind of this textbook definition. But in, orthopedic injury pathology literature, you'll read a lot about how a tendinitis really isn't an itis or an inflammatory response, but it is a degenerative condition of the tendon, again, where the tendon kind of breaks down. So similar to the stress fracture, where there's, again, a disruption in kind of that remodeling process, you get a similar thing with tendinitis. So these are two very common things that you will see in particularly in active individuals. Not uncommon to see. Again, both of these are micro traumas and are associated with overuse. So in looking at tissue healing, so all tissues basically follow the same pattern of healing. Now, a lot of your tissues will kind of follow these at different rates to a degree and have different things going on. So we're just going to look at the healing process in general. We're not going to break it down by what goes on with a tendon versus a ligament versus a muscle. We're just going to look at the healing process. There are some slight differences in like what goes on with each one of those tissues based upon blood supply and everything else. But at the very least, this will give you kind of a good background as far as what goes on. So there's essentially three phases to the healing process. There's the inflammatory phase. There's the repair phase, or what's also called the fibroblastic repair phase, or some people call it the proliferation phase. And then there's the remodeling phase. So these are the three different phases of healing. Again, there's going to be kind of some like little unique nuances in between tissues, but for the most part, the time frames and everything are very similar, and there's similar considerations that you have to look at within each one of these phases. So with healing, again, your three phases of healing, there's various factors too that can affect healing as well. So when we look at the three phases of healing and the different factors that can affect them, these are some things that kind of come out. You have the age of the individual, the lifestyle, so again, sleep, nutrition, things of that nature. The degree of injury is obviously going to be one of the bigger things. Obviously, if you have a complete tear of a soft tissue structure, that's going to, obviously going to, the time frames are going to be a little bit longer than would be if there was just a stretch or slight partial tear. And then again, as I had previously alluded to, with the structure, again, looking at a tendon versus a ligament versus a muscle versus a bone, if you will, they all kind of have different healing processes and what goes on with them. Again, for the most part, what we describe is kind of a good general overview. Again, those of you, for instance, that are going into athletic training will get a much more in-depth look at this healing process and kind of what goes on with each phase. So this is just kind of a little preview of the phases. So this is in your textbook. This kind of tells you sort of what's going on with each one of the phases. So again, you have the different names already, which I kind of already brought up. So again, you have your inflammatory response phase, the fibroblastic repair phase, or again, sometimes they call that the proliferative phase, and then the maturation remodeling phase. And it's kind of nice. This kind of lines up what goes on, and we'll go a little bit deeper into this further into the discussion. But the inflammatory phase, you have your classic inflammatory signs and symptoms. That's where you have your pain, swelling, redness. There's decreased collagen synthesis. So collagen is basically the protein that makes up most of the connective tissue or gives connective tissue its strength. Obviously, if there's damage to that tissue, there's decreased collagen synthesis. The inflammatory phase is essentially kind of like the phase where a lot of the chemicals involved with the healing process get released. And again, you have some of these other, classically what we think of with, like, for instance, with an acute injury that happens, the swelling and everything that occurs. The fibroblastic repair phase is just that. It's when you're basically starting to form sort of that base for repair to take place. It's sort of that the initial scar tissue comes into play, and we'll kind of talk about the different types of scar tissue. So all of your soft tissue, your connective tissue is going to heal with scar tissue. And this is where that scar tissue starts to get formed. It kind of talks about what's going on here. Decreased collagen fiber organization. So there's collagen fiber production, but it basically during the fibroblastic repair phase, it's kind of laid down in sort of an unorganized manner. It's during the maturation remodeling phase where that collagen fiber gets realigned and starts to gain strength. So in the fibroblastic repair phase, the inflammation phase kind of starts to turn itself off. The goal there tends to be getting some more scar tissue laid down. However, it's just sort of the initial scar tissue. It's not really organized or anything like that. And then during the maturation remodeling phase is when it kind of gets as close as it can be to the original tissue. So again, anytime there's a tear in tissue, it's never quite exactly the same, but hopefully with appropriate treatment and rehabilitation, it kind of gets as close as it possibly can. Okay, so we're going to kind of look at some of the different things so the chart on the previous slide kind of did go through some of the basic things as it relates to the different phases. So the inflammatory phase is the body's initial response to injury, and is necessary for normal healing to occur. So again, an inflammation sometimes gets a little bit of a bad rap. So inflammation on the whole is not a bad thing, particularly when you have injury. Now, it's when you have like systemic inflammation from like chronic illness and stuff like that, that's obviously bad. And there's actually some things related to the acute inflammatory phase with an injury that you still need to control to make sure that you have kind of that real optimum and kind of expedite your healing process, if you will, as quickly as you can. But you need the when a tissue is injured, you need inflammation in order for it to occur. And again, during this time, the injured area will become red and swollen. Now, the swelling is one of those things that unfortunately is a unwanted sort of side effect of inflammation that we want to make sure gets controlled. And that, on the sports medicine side of things, there's modalities and things like that can be done to kind of limit how much swelling will actually occur. The fibroblastic repair phase. So the fibroblastic repair phase, once the inflammation phase has ended. Now again, these phases do kind of sort of blend into one another, if you will. But it's during the fibroblastic repair phase. Now all those, chemical and cellular reactions that happen with the inflammatory phase are going to start to wind down a little bit more, and now you're going to start to replace the tissues that were damaged, or as stated here, are no longer viable from the injury. Okay. This phase of healing can begin as early as 2 days after the injury and may last up to 2 months. So 2 days after the injury, you will start to get typically some actions of the repair phase taking place. It doesn't necessarily mean that the inflammation phase has completely ended. It just may be starting to hopefully wind down, hopefully with some of the early interventions, some of the the pain and the swelling that occurs, is hopefully been limited and controlled to the point where again, the individual can start to sort of pick up their activities a little bit more. Again, you still do have to be a little cautious and make sure that that early scar tissue doesn't get stressed too much. And we'll kind of talk about that in later talks as to, the types of activities that typically get done in these phases.